I think that one of the things people have got to realize is that the older adults, yes, have had a lot of experience and really enjoy reliving some of their experiences. And probably the best thing to make good friends with somebody who's older is to tell me something that would have happened to you when you were my age. And then they go back in their memories and they love to talk about that kind of thing. They just feel totally at home reminiscing. So get to know your patient. Realize what a lot they have to give you. You may be giving them something, but they're going to give you something. I think just to have them talk about any one memory they've got. Of course, if they have trouble remembering anything, then maybe that's not a kind question to ask them. But mostly, if they be people like me, they enjoy talking about way back when. And accept that as a kind of a starter. Give them a chance to let you get to know them at your age so that they can relate better to you. Something silly or something funny that happened to you, or something very sweet that happened to you. And get them talking. In other words, make friends with them. Get to know them as people, not just a patient with so-and-so. Right. That is so important. And I think you're not going to have time all the time in the world to go through the person's whole history. So you've got to sort of maybe cut them off at a certain point and say, well, that was a wonderful story. Now I'm going to ask you some questions. And then you can begin to turn the conversation around. But I think that to let them know that you're interested in them as a person, not just a case of so-and-so, is very important. And then once you've got that person's confidence and their feeling of trust in you, the rest of the communication is going to be easy. But if they feel sort of they want to clam up, they don't want to talk to you about that because you're not interested, you don't care about them, I think you can forget about it as a patient. You're not going to have much of a communication. So get them to tell you something of when way back. You know, where did you grow up? Or what was life like for you? Tell me something that happened to you when you might be my age. What else?
Do you ever feel, now going to the doctor's office or hospitals, do you ever feel hurried?
Not with my present doctor. He's very good. And what I especially like about him is that when he asked me for all the list of medications that I'm on, he'd say, I wonder whether you really need to be on that now. And so he takes me off medications. In fact, he says he feels his mission in life is to get people off their medications as much as possible. And really, only the essential ones. I don't take anything for blood pressure, though I know my blood pressure would be in the high range. He says, if it goes 160 systolic, then maybe you should take something. But I've dropped all the other medications. He said, your brain needs that blood. So if you take some stuff to keep your blood pressure down, your brain may not get enough blood, and then you're going to be dizzy.
Right, right. So how many medications are you currently taking on a regular basis?
2 prescription.
Great. So when they talk about polypharmacy in older adults, they're talking about 3 or 4 medications and more. You really don't have that issue right now.
Not now. I was with a previous doctor. I was getting put onto things.
How did you feel?
And I kept wondering if I really needed it.
Okay.
And I didn't feel myself.
Okay.
And I feel I want to be that way. Even if it's a shorter life, I want to be able to live it the way I am.
Feeling clear, feeling energetic, feeling like yourself.
That's right. Yes, yes.